Hi, I'm Dr. Sangeeta Honnur, founder of Smile Elements Dental, an aesthetic, orthodontic and an implant dental center, Bellandur, Bangalore. Dentures are usually done for missing teeth, and especially we see that in the elderly that they're being done. And usually when dentures are made, it's actually one denture for the upper, what we call as a maxillary denture, and one denture for the lower, which is called the mandibular denture. So in terms of how the denture stays in the mouth is what is called as retention of the dentures. And typically whenever these dentures are done, we do see that upper dentures tend to fit well compared to the lower dentures. Lower dentures, most of the patients, especially if they are first time denture wearers, you do see a lot of frustration from how the denture seats itself and how the patient is comfortable. The reason being there is a tongue which is a muscle, and there is a lot of movement that is happening in the lower jaw. And even compared to the upper jaw, the mandibular teeth, that is the lower ridge of the missing teeth, is much more thinner and not as fibrous. So the retention of the denture is very, very difficult for the patient to control. And when you eat food, the food itself that tries to go inside and displace the denture is one of the very common things that you see. Though there are a lot of changes, materials and kind of denture material that has come, which claim to be one superior than the other in terms of adaptation, and there are techniques and the specialists who do them also. But just over a period of time, the resorption also that keeps happening when no teeth are present makes the denture loose, and having to replace them, one of the very common scenarios that we see. So the best way to really have them dentures is to have implant supported dentures. There are different ways of doing it. Sometimes the minimum which has actually become a standard protocol now, is to advise 2 implants in the front area for the denture to be held in place, that is the lower denture, or else all on 4 is the other concept that has come, where 4 implants are placed for the denture to be supported. So definitely when this is done, the way the denture is going to last in the long run and how comfortable the patient is going to be and confident also is much better with implant supported dentures than with regular removable dentures.